Hi, everyone. I'm Catherine Gregory, co-founder of Modern Wisdom Press. And today I'm so excited to introduce our newest author, Dr. Mark McGinley, in this author spotlight interview. And he was born in Ireland, received his medical degree from the University of Cape Town, and then immigrated to the US in 1992. So for the past 30 years, he's been practicing as a specialist in pulmonary and critical care medicine and has extensive experience working with hospital administrators to build programs that benefit physicians and patients. Welcome, Dr. McGinley. Thank you so much for your time and for sharing more about your book with us today.
Thanks, Catherine. Well, I might as well start with this. This is my book, Critical Relief, a CEO's Guide to Transforming Hospital Culture. And this is me. It's really been a long journey. I've been in healthcare for 30 years, and in the last 15 years or so, there's been a huge transformation. Most hospitals now aren't standalone. They're part of big healthcare organizations. And with that comes some good and some bad. Yes, there's more expertise, more resources, but sometimes it changes the culture. And what I've noticed from my colleagues, and then personally when our hospital was taken over by a big healthcare corporation, is that the service experience can be less than desired, and physicians start to become disposable, or in a manufacturing term, like widgets, take it or leave it, move around. And, there's less and less consideration of our input. Decisions are made before we're asked. This type of thing was going on more and more. And when it finally hit me personally in our organizational takeover, I felt that this was an important thing to write about. And that was the inspiration to write about this book. And really the essence of my book is to make the physician the primary focus of your customer service. Most CEOs in hospitals believe that the patient is their primary customer. And my book is really a challenge to that, saying if you take care of your physicians first, they will take care of their primary customer, which is the patient.
I love that ripple down effect, Mark. Thank you so much. And so, Mark, when you began writing your book, I know we talked a lot about who this ideal reader of your book was. And so can you explain that here to our audience about how you chose to focus on the leadership team in a hospital, or the healthcare physician CEO leader as the audience or the ideal reader of your book?
Yes, I've worked closely with CEOs throughout my clinical hospital career. And, I've come to realize that the culture is really determined by the actions and leadership of the CEO. And what I've noticed recently in the last decade or so is that CEOs are now becoming more of at a distance from physicians. There's these other intermediaries like clinical physician teams and clinical care teams, and that act like a buffer between the physician and the CEO. And the people who are administering and managing the hospital are getting more and more disconnected from the people who are delivering the care. And in parallel with that, there's a huge problem with physician burnout, physician shortage. And so I've come to realize that the only way, in my opinion, to stop this exodus of physicians and improve retention, improve patient care, is to get CEOs back into the driving seat of connecting with physicians, creating the culture, listening to them, and working as teams together. And this disconnect has to be bridged. And really, they're the only people who can do it, in my opinion. And therefore, the book is pitched at the CEOs to help them understand physicians better and deliver better care within their hospitals.
Yeah, I really think that's critical. And like you said, the trust and cooperation aspect of this teamwork between leadership and physicians then has this beautiful trickle down effect on all of the teams, and ultimately the patient of the healthcare system and their families. Can you speak to that as far as how you've seen or interacted with teams that have effective culture and teamwork and communication? Because I know you talk about this in your book, and use, you know, situations, and you have very practical tools for these leaders to then take into their teams and see transformation happen.
Yes. Well, you know, from my own experience, for example, I helped with the input of physician leaders, CEOs, and CFOs put together an intensivist program at Wyoming Medical Center. And that was a trickle-down positive effect. The thoracic surgeons, the trauma surgeons, the neurosurgeons loved having an intensivist in-house day and night. The emergency room loved having it. The family practice residents loved having it. The hospitalists loved having it. But most importantly, the nurses loved having someone who was there. There was direct communication right there, right now at the bedside. And this had an effect on patients. We measured things like ventilator-associated pneumonia, catheter line infections, urinary tract infections, ICU length of stay. All these things got much better when we started the intensivist program, and the literature supports that. So that was a classic example of working together as a team, understanding each other, and having a common goal with a huge trickle-down effect to other specialists, nurses, and ultimately patient care.
I'm really glad you're mentioning this, but just as a recent experience of my own in a hospital with my father, and the lack of that team understanding or team communication really leaves a patient's family in the dark, really leaves the patient frustrated. And I think ultimately that's the goal of the organization, is to have improved patient care and trust and accountability on that patient level too. So I'll just speak to that from my own personal experience as a patient, that I could see if there was this communication between all of those different teams for the patient's care, how differently that experience would be for the families and the patient.
Yes.
Yes.
Yeah.
So thank you. And then I know that inside the book also you talk about, these leaders of these organizations do feel like they have their hands tied a little bit from these corporate ownerships. And so how do you see navigating that from a CEO in a big system to begin to really make an impact on changing some foundational culture issues and team issues?
Yeah, like my book came out last month and it has 11 chapters. And one of the chapters is actually devoted to that, dealing with the head office. So, it's not true that the local CEO is just a puppet of the upstream, head office management team. A lot can be done at the local level, again, through open communication, availability, asking first and making decisions after you've had input, not the opposite way around, just making a decision and then telling people what you've done. That open door type of come talk. I want to understand your pain points. I go into that in a lot of detail. If we don't work together, there's just going to be an increasingly big divide between the needs and wants and aspirations and requirements that physicians have to do their job, and the equal set of issues that CEOs have on their desk to do their job. And we actually are, unfortunately, sort of drifting in opposite directions with this corporate takeover, and I think it's totally fixable, but it has to be done at a local level with a more open, inclusive form of communication. I go into it in more detail, but that's really the bottom line. The current system's not working.
And I think what you just said is very key, and it's like sparking conversations, open door, let me hear about your pain points. And I think your book in and of itself is that. It's an open door for these conversations to start happening. And it's so vital in this system that's really not working, that's dysfunctional. So I just want to appreciate and honor you. And thank you for writing this book. And I know you just mentioned before we got on our call together today that you were just on a podcast talking about your book. And I think, reaching audiences through podcasts and being able to, just initiate conversations about how to heal a broken system is really powerful. Can you share just a little bit about how that podcast happened? And I think you said it was sparked by the book. So I'd love to hear more about that.
Yes, it's an interesting full circle, really. I came to Wyoming Medical Center in 2003, and the professional recruitment company that the hospital used was called Pacific Companies in California. And I've kept in contact with the CEO of that company, 𝗖𝗿𝗶𝘁𝗶𝗰, and he read my book and reached out to me, and he said, "We do podcasts. I want to interview you." And so he's very well connected to multiple hospitals across the United States and CEOs. So I think there'll be traction with clinical leadership, hospital leadership, just because of his outreach. They've been doing this for 3 decades. But it was really wonderful because here I am coming to sort of the latter part of my career, and the person who interviews me for a podcast is the person who really got me into the most enjoyable, biggest chunk of my professional career. So it was a beautiful synergy.
I love that. I love that. And I imagine only more doors will keep opening and sparking new conversations around this topic, Mark. So when you think back on your book journey, I'm just curious, like, what surprised you most about, writing this book and then delivering it to the marketplace? I know that you do have some consulting work that you do with teams. And so I just want to ask about that and understand where you are in your career. You said you're coming to a pivot point, and talking about this subject is really inspiring to you. So can you share a little bit more about that work, consulting and the Inventist?
Yeah, I actually have never written a book. This was my first book, and I really enjoyed the guidance and direction and input from you and the other professionals at Modern Wisdom Press. I had the imposter syndrome too. I'm like, who am I to write a book? But it really became clear to me that this issue about physician shortage, physician burnout, and why was very clear to me. I'm a critical care doctor. I see things I can cut through the dust to get to the core issues. And to me, it was really poor customer service, and no one was writing about that. Everyone was talking about it in the corridors and in the doctor's lounge and moaning about it, but no one was actually putting it out there as a structured, thought out conversation. So I felt like I needed help. I just didn't know how to start that process. And you particularly and the rest of the experts there guided me along the way. My real hope with the book is I'm not naive enough to think people will read my book and everything will be perfect in their organization. It's really to spark the pivotal conversation to refocus customer service within healthcare and to bring physician experience and physician customer service to the forefront. If that conversation can be engaged because of my book, I will be a very, very happy author. I am very happy to talk about this to organizations, and if they want me to come and spend a few days with their leadership team, I'm equally happy to do that. But really, I think organizations, first of all, have to see the why it's important, and then they'll figure it out. My book's just a sort of a roadmap. The specifics will be different depending on each organization.
But I do love that you have practical tools. You have real life examples of what's worked and how to apply that for your readers. And so thank you so much for writing this book, Mark. And I'm really inspired about the changes that can come from these conversations that your book will spark. And thank you so much for your time today. And is there anything else you would like to share with our audience about writing a book or your work?
Yes. I would think it's correct to say that most people who want to write a book never write a book. I think that would be a common experience.
3%
And
is a statistic. 3% begin.
3%.
Mhm.
So you deal with a very interesting population that really I found was so helpful. You have a process. It takes you through a very strong inward look, inward journey, analytical and well thought out way to structure your book, how to use your time, all the pitfalls that you're going to run into as you're an author yourself, and Nathan, who's in charge of most of the technical side, is author as well. And then the editors that really take something that's a little rough and make it very polished. It's a total process that gives confidence. And, I felt like you had my back every step of the way. So I think that was the difference from being another one of the 97% that never write the book. You have a process that works. And that to me was the magic sauce that was missing, because I've toyed with this idea for so many years and never really had a way to get it done. So that was a very positive experience for me.
Well, thank you so much, Mark, for trusting us on your book birthing journey. And I'm just really excited about this book topic. And I know the conversations that come from it can spark real change. So thank you for the courage to step up and be the one to write this book. Thank you.
It's my pleasure. Thank you for this interview.